Seniors, if your legs feel heavy, numb, or cramp up at night, listen carefully. Most people are told to take magnesium for circulation, but new research shows there's another vitamin that may work even better for improving blood flow to your legs. The shocking part, many seniors are dangerously low in it without even knowing. Stay with me because this one simple vitamin could change how your legs feel every single day. And nighttime leg cramps, tingling feet that wake you up, that heavy dragging feeling in your legs by evening. Your doctor probably told you to take magnesium, right? And maybe it helped a little, but the problems keep coming back. Here's what most doctors won't tell you. Magnesium only addresses the symptom, not the root cause. There's another vitamin that actually restores blood flow to your legs, and it's been hiding in plain sight this whole time. Next 14 minutes, I'm going to show you why magnesium falls short for leg, circulation, and reveal the one vitamin that works at the source of the problem. This isn't about choosing between the two. It's about understanding what your body actually needs to restore healthy blood flow after 60. Before we dive in, drop a comment telling me where you're watching from and whether you've tried magnesium for leg cramps. Did it work? Did the relief last? I want to hear your experience. And hit that subscribe button because I share practical health strategies like this every week to help you thrive after 60. Let's start by talking about magnesium, because I need you to understand why it's not the complete solution everyone thinks it is. Magnesium has become the go-to recommendation for leg cramps and circulation issues. Walk into any pharmacy, mention leg cramps, and you'll walk out with a magnesium supplement. But here's the problem. Magnesium works primarily on muscle relaxation, not on blood flow. Yes, magnesium helps your muscles contract and relax properly. Yes, it can reduce some cramping, but it does absolutely nothing to address the underlying circulation problem. Think of it this way. If your garden hose is kinked and barely any water is getting through, magnesium is like trying to fix the problem by adjusting the sprinkler head. You might get a slight improvement, but you haven't opened up the hose. The first major disadvantage of relying only on magnesium is that it doesn't improve blood flow. This is the biggest issue. Magnesium does not dilate your blood vessels. It does not improve oxygen delivery to your tissues. It does not address arterial stiffness or plaque buildup. When your leg symptoms are caused by poor circulation, which they usually are after 60, magnesium is treating the wrong problem entirely. You might get temporary relief from cramping, but your circulation remains compromised. The second disadvantage is that digestive side effects are extremely common. Many people can't tolerate magnesium supplements because they cause digestive upset, diarrhea, stomach cramping, nausea. These are extremely common side effects, especially with magnesium oxide, which is the cheapest and most common form in supplements. Some people end up taking doses too low to be effective just to avoid these uncomfortable side effects. And if you're already dealing with digestive issues, which many seniors are, adding magnesium can make things worse. The third disadvantage is that magnesium can interact dangerously with common medications. This is serious and often overlooked. Magnesium supplements can interfere with antibiotics, blood pressure medications, bisphosphonates for bone health, and certain diuretics. If you're taking multiple medications, which most people over 60 are, magnesium supplementation needs careful monitoring. Too much magnesium combined with certain medications can lead to dangerously low blood pressure or irregular heartbeat. The fourth disadvantage is that the relief is often temporary. I've had countless patients tell me the same story. Magnesium helped at first, but after a few weeks or months, the symptoms came back. That's because they never addressed what was actually causing the problem. The blood vessels are still narrowed, the circulation is still poor, the oxygen isn't reaching the tissues. Magnesium gave temporary muscle relief, but it didn't fix the highway system that delivers blood to your legs. Now, I'm not saying magnesium is bad. It has its place. If you have a true magnesium deficiency, supplementing makes sense. But for circulation problems specifically, you need something that actually improves blood flow. And that's where this other vitamin comes in. Let me explain what's really happening inside your body when circulation starts to fail, because understanding this will show you exactly why the vitamin I'm about to reveal is so powerful. Think of your blood circulation like a highway system. When traffic flows smoothly, oxygen and nutrients reach every cell and you feel energized and strong. But when circulation declines, it's like roads narrowing, exits closing, and traffic backing up. The early signs are easy to miss, and that's the real danger. Poor circulation happens when blood flow becomes sluggish or blocked, especially in your feet and legs. The causes include plaque buildup in arteries, weakened vein valves, high blood pressure, diabetes, prolonged sitting, and natural aging. Your blood vessels lose flexibility. They narrow. Blood can't push through as easily. What makes this dangerous is how quietly it develops. Swollen ankles, cold toes, minor discomfort. People brush these off as normal aging, but these are serious signals your body is screaming at you. When blood vessels lose flexibility, the risk of clots increases dramatically. Without proper blood flow, your body can't flush out toxins, leading to inflammation, infections, and faster aging. Professor Dr. Joel Kessler, a leading expert in regenerative medicine, states it clearly. Blood flow is essential to every aspect of healing and vitality. Without circulation, nothing functions properly. The good news, when caught early, poor circulation can often be reversed with the right nutritional approach. Not just managed, actually reversed. Let me walk you through 5 warning signs that tell you your circulation is already compromised. If you recognize yourself in these symptoms, pay close attention because the vitamin I'm about to reveal addresses every single one. The first warning sign is changes in skin color. Have you noticed your feet or ankles looking pale, bluish, or marked with dark patches? This isn't cosmetic, it's oxygen starvation. When blood isn't flowing properly to your extremities, your skin literally changes color because it's not getting enough oxygen. These areas feel cold to the touch and heal slowly when injured, opening the door to infections. The second warning sign is cramps during walking or at night. A sudden sharp cramp in your calf while walking that forces you to stop could indicate intermittent claudication. That's a lack of oxygen in your leg muscles from narrowed arteries. Nighttime cramps are even more telling. They disrupt your sleep and signal that your muscles are literally crying out for more oxygen-rich blood. The third warning sign is persistent tingling and numbness that pins and needles sensation in your feet, especially after sitting or standing for a while. When this becomes regular, it points to nerve stress from insufficient blood flow. Your nerves need constant blood supply to function. Without it, you feel tingling and numbness. Over time, this leads to peripheral nerve damage, affecting your balance and dramatically increasing your fall risk. The fourth warning sign is cold feet, even on warm days. If your feet feel like ice blocks when the weather's warm, blood isn't reaching your extremities properly. This happens when vessels are narrowed or blocked. I've had patients wearing socks to bed in July because their feet feel frozen. This indicates arterial problems like atherosclerosis and weakens your feet's natural defenses. The fifth warning sign is varicose and spider veins. Bulging, twisted veins, often bluish or dark purple, are one of the clearest signs of poor circulation. These form when valves inside veins weaken, allowing blood to pull in your lower limbs. This causes discomfort, swelling, and that heavy feeling in your legs by day's end. Spider veins, those tiny red or purple lines, are also warning signs of compromised vein health. If you're experiencing multiple symptoms, consult a vascular specialist. A simple ultrasound can identify issues before they become dangerous. Now let me tell you about the one vitamin that actually restores leg circulation and addresses all of these problems at the root cause. If you're finding this helpful, go ahead and hit that like button. It helps us reach more seniors who need this information. The vitamin that restores leg circulation after 60 is vitamin B3, also called niacin. Here's why vitamin B3 beats magnesium for circulation. It actually expands your blood vessels. This is called vasodilation. When you take vitamin B3, your blood vessels literally widen and relax. Remember that kink to analogy? Vitamin B3 UNCCs. It opens up the pathway so blood can flow freely to your legs and feet. This is fundamentally different from what magnesium does. Magnesium relaxes muscles. Vitamin B3 opens blood vessels. One addresses a symptom, the other fixes the delivery system. The first benefit is natural vasodilation. Vitamin B3 triggers the release of prostaglandins, which cause your blood vessels to expand. This expansion allows more oxygen and nutrients to reach your tissues. Within weeks of getting adequate B3, many people notice their leg symptoms improving dramatically. The fatigue lessens, cramping decreases, cold feet warm up, and that heavy dragging feeling lifts. The second benefit is cholesterol management. Vitamin B3 is one of the most effective nutrients for improving your cholesterol profile. It lowers bad LDL cholesterol while increasing good HDL cholesterol. This is critical because high LDL leads to plaque buildup in your arteries, which is one of the main causes of poor circulation. By balancing cholesterol, vitamin B3 prevents fatty deposits from narrowing your arteries. The third benefit is that it reduces inflammation in blood vessels. Chronic inflammation damages the inner lining of your blood vessels, making them stiff and narrow. Vitamin B3 has anti-inflammatory properties that protect and repair blood vessel walls, keeping them flexible and responsive. The fourth benefit is that it prevents blood clots by improving blood flow and reducing arterial plaque. Vitamin B3 lowers your risk of dangerous clot formation. This is especially important for seniors who face higher clot risks that can lead to stroke or pulmonary embolism. Studies back this up. One study found that seniors who increased their B3 intake experienced a 40% reduction in leg cramping and numbness within just 8 weeks. Another showed improved walking distance and reduced pain in patients with intermittent claudication. This isn't theory, it's proven science. Here's something most doctors won't tell you. Vitamin B3 deficiency is extremely common in people over 60, yet it's rarely tested for. Why? Because the symptoms develop slowly and are attributed to normal aging: cold feet, tired legs, poor sleep from leg cramps. Doctors hear these complaints and assume it's just getting older, but in many cases, it's a correctable vitamin B3 deficiency. Your body's ability to absorb B3 decreases with age. Medications like statins can deplete B3 levels, and many seniors simply aren't eating enough B3-rich foods because they've reduced their protein intake or lost their appetite. The result? Your circulation suffers silently for years while you try magnesium, compression socks, and other Band-Aid solutions that don't address the real problem. So where do you get vitamin B3? The best food sources are chicken breast, which is skinless. 100 grind provides over 50% of your daily needs. Salmon is another great source. A 3 Oz serving gives you about 53% of daily requirements. Tuna, especially yellowfin, is one of the richest sources. A 3 Oz serving provides over 90% of your daily requirement. Eggs are also good. 1 large egg gives you about 4% of daily needs, and almonds, where a 4-cup provides about 25% of your daily B3. The recommended daily amount for adults over 60 is 14 to 16 milligs for women and 16 to 18 milligs for men. However, if you're already deficient and experiencing symptoms, you might need more initially to restore healthy levels. Some therapeutic studies used 100 to 500 milligram under medical supervision. Let me give you a practical day of eating. For breakfast, have a 2-egg omelet with spinach and whole grain toast. For a mid-May morning snack, enjoy a 4-cup of almonds. For lunch, have a chicken breast salad with mixed greens and olive oil. For an afternoon snack, try tuna on whole grain crackers. And for dinner, have grilled salmon with roasted vegetables. With this simple day, you're getting well over 100% of your daily B3 needs, plus other nutrients that support circulation like protein, healthy fats, and antioxidants. Now, you might experience something called the Nasen flush when you first increase your B3 intake, especially from supplements. This is a harmless warming sensation and redness of the skin, usually on the face and neck. It lasts 15 to 30 minutes and diminishes as your body adjusts. This flush is actually the vasodilation effect in action. Your blood vessels are opening up. If you want to avoid it, choose time-release NAN or get your B3 from food sources, which cause a much milder effect. Vitamin B3 works best when combined with healthy habits. You can't just eat chicken and salmon and expect perfect circulation if you're sitting all day or eating processed foods. Small changes create big results. Move more throughout the day. Even 5 minutes of walking every hour helps. Stay hydrated because dehydration thickens your blood, reduce inflammation by cutting back on sugar and processed foods, and manage stress because chronic stress constricts blood vessels. Let me share a story about my patient Margaret, age 67. She came to me with severe nighttime leg cramps, constantly cold feet, and heavy legs by afternoon. Her doctor had given her magnesium supplements. They helped a little with the cramps, but didn't solve the problem. When I reviewed her diet, she was eating almost no B3-rich foods, mostly toast, cereal, and salads with very little protein. I had her add 1 serving of chicken or fish daily and a handful of almonds as a snack. Within 2 weeks, her nighttime cramps were less frequent. By week 4, they were almost gone. Her feet felt warmer, and the heaviness improved significantly. By week 8, she felt like she had her energy back. She was sleeping through the night, had warm feet, and was walking much longer distances without fatigue, all from ensuring adequate vitamin B3 every day. This is the power of addressing the nutritional deficiency that was silently sabotaging her circulation. Here's your action plan to get started today. First, assess your current B3 intake. Look at what you ate yesterday. Are you getting enough B3-rich foods? Second, choose 1 meal today to add a B3-rich food, maybe eggs for breakfast or chicken at lunch. Third, plan your weekly shopping to include chicken breast, salmon, tuna, eggs, and almonds. Fourth, track your symptoms. Notice your leg cramps, cold feet, tingling, and fatigue over the next few weeks. And fifth, be consistent. This isn't a quick fix. It's about nourishing your body properly every single day. If you have symptoms or a family history of circulatory problems, talk with your healthcare provider, especially if you're on blood thinners or other medications. Remember this: magnesium relaxes muscles. Vitamin B3 opens blood vessels. Both have value, but for circulation problems specifically, vitamin B3 addresses the root cause. Better circulation means better brain function, better heart health, stronger legs, better sleep, more energy, and a longer, more active life. Before you go, comment below with your age and location. Tell me, have you tried magnesium for leg issues? Did it work long term? I read every comment and love hearing from you. If this video helped you, share it with someone who needs it. Many people suffer with these symptoms for years, thinking it's just aging. This knowledge can truly change lives. Thanks for watching. Hit that like button and subscribe for more life-changing health tips designed specifically for seniors. Better circulation starts with small steps you can take today, and it all begins with vitamin B3. Stay strong, stay healthy, and before you leave, take a moment and tell me in the comments your age and where you're watching from. I always love hearing from our community, and if you've experienced leg cramps, cold feet, or that heavy feeling in your legs, let me know if magnesium ever helped you or if the problem kept coming back. If you found this video helpful, please like the video and share it with someone who might be struggling with the same symptoms. And don't forget to subscribe to the channel for more simple, science-based health tips designed to help you stay active, strong, and independent after 60. Take care of your body. Keep your circulation strong.